concern in healthcare and public policy. It shows that patient safety emerged as a distinct locus of attention in a specific historical context, and that its rise to its present worldwide prominence was by no means a given, because social concerns are projections of collected sentiments rather than simple mirrors of objective conditions in society. Thus, understanding how patient safety emerged, how and why it has evolved and changed as it has over time, and the accompanying rise in bureaucratic medicine are keys to understanding patient safety's current state, its character, strengths, and limitations. At a time when most agree that progress on safety has been slow or even stalled, understanding this course of development and the forces that led to it will be important for safety efforts in healthcare to break out of their current doldrums. Part 1. The Rise of Patient Safety. 1. Setting the stage. To extract something familiar from something unknown relieves, comforts, and satisfies us. With the unknown, one is confronted with danger, discomfort, and care. The first instinct is to abolish these painful states. Any explanation is better than none. Friedrich Nietzsche. On November 29, 1999, both NBC's and ABC's evening news programs led with stories focused on a document leaked from the National Academy of Sciences' prestigious Institute of Medicine, IOM. The leaked report, titled To Err is Human, TEIH, claimed that medical errors were a major killer of Americans. Peter Jennings of ABC News opened the broadcast ominously. We're going to begin tonight with a leading cause of death in America, medical mistakes. According to the National Academy of Sciences, tens of thousands of American people, American patients, are dying simply because mistakes are made in hospitals by doctors, by nurses, and by pharmacists. The Academy study estimates today that more than 44,000 people, and perhaps as many as 120,000 people, die every year because people make mistakes. The next day, the story headlined the New York Times, Washington Post, USA Today, Los Angeles Times, London Sunday Times, and all three major network morning news programs. It was picked up that week by three major news magazines and multiple wire services. One estimate suggested that stories of medical error as a leading killer of Americans reached more than 100 million people within a week. The widespread attention was in part because of the report's dramatic language. More people die from medical errors than from motor vehicle accidents. The report combined startling projections of mortality, 44,000 to 98,000 annual deaths in hospitalized patients, with poignant stories of personal tragedies. It also promoted ambitious goals, aiming to break this cycle of inaction in a language of outrage. To settle for anything less than a 50% reduction in errors over 5 years would be irresponsible. The status quo is not acceptable and cannot be tolerated any longer. It is simply not acceptable that patients should be harmed. And must we wait another decade to be safe? The reaction to the report was frenetic. Organizations whose responsibilities were to ensure patient safety, including the Joint Commission and the National Quality Forum, appeared caught with their pants down and issued hastily assembled safety goals. The Clinton administration organized a task force, announced plans for a new Center for Patient Safety, and endorsed the goal of 50% reduction in errors by 2005. On examining their budget, they might have found that the administration had already funded a $20 million safety research effort in the current federal budget. These reactions fit the pattern of a moral panic, which occurs when a condition becomes understood by the public as an evil that poses an existential threat. Moral panics tend to arise during times of rapid social change, certainly the case for healthcare around the turn of the century, and are propped up in part by media attention and humans' natural tendency to tell stories in evocative terms. In the case of reporting around TEIH, the error framing and its vivid metaphors, including automobile and airline crashes, had clear dramatic intent.